In this video, we'll discuss horizontal gaze palsy, the structures involved in the horizontal gaze and the features. So if both eyes move to the right in a horizontal plane, the right eye moves laterally or abduct and the left eye moves medially or adducts. So what muscles are involved in this section? Right eye abducts. It's the function of lateral rectus muscle, which is supplied by the sixth cranial nerve, the abducens nerve, and the left eye in this case moves medially, and the medial rectus is supplied by the oculomotor nerve, the third cranial nerve. So why these two muscles supplied by two different cranial nerves act simultaneously for a horizontal gaze? So how this movement is controlled? Frontal eye field area 8 controls the eye movement. The information for motion is processed in the visual cortex area 17, the visual association area 18 and 19, in the temporal lobe and in the cerebellum. In the cerebellum for smoothness of the action. The frontal eye field is then connected to the opposite or contralateral paramedian pontine reticular formation. The paramedian pontine reticular formation is connected to the nucleus of the abducens nerve on the same side. So it's connected ipsilaterally to the nucleus of the sixth nerve, which supplies the lateral rectus muscle ipsilaterally, and at the same time this nucleus via medial longitudinal fasciculus gives a connection to the medial rectus components of the oculomotor nerve on the opposite side. So when stimulus comes, both eyes are turned to the same direction. The abducens nerve nucleus also receives information from the movement of fluid in the semicircular canal by the eighth cranial nerve. This is for the other side, the right frontal eye field area controlling the left lateral rectus and the right medial rectus via paramedian pontine reticular formation. So lesions of what structure cause horizontal gaze palsy? A lesion in the frontal eye field area 8 causes paralysis of the conjugate movement of the eye, and the eye moves ipsilaterally, that is looking at the lesion. Why they move ipsilaterally? Due to the inability of the muscle to look on the opposite side because of the unopposed action of the contralateral frontal eye field area 8. In this case, if the lesion is on the right side, the right eye moves to the right and the left eye also moves to the right, looking at the lesion, moving ipsilaterally. Whereas an electrical stimulation or an epileptic focus or an irritative stimulation of the frontal eye field moves the eye to the opposite side. They cause conjugate gaze contralateral to the stimulation. So there is a difference between the lesion of the frontal eye field and the electrical stimulation by a focus. In destructive lesions or damage, it moves ipsilaterally, and in an irritative focus, it moves contralaterally. And then a lesion in the paramedian pontine reticular formation and the abducens nucleus causes palsy of the ipsilateral lateral rectus and palsy of the contralateral medial rectus muscle, because this is connected to the contralateral side.